Hello, and thank you for joining us today. My name is Noah Tom, and I am a provider educator for NYRx Education and Outreach. We would like to welcome you to the NYRx Education and Outreach Cover My Meds Electronic Prior Authorization for New York State Medicaid Prescribers webinar. This webinar is intended for prescribers and their authorized users. On our agenda, we will provide information about prior authorization and NYRx, the Medicaid Pharmacy Program, and electronic prior authorizations CoverMyMeds to NYRx. Throughout this presentation, you will hear us refer to ePA, which is short for Electronic Prior Authorization. We will show you how to accomplish tasks, including how to create an account, navigate the dashboard, verify prescribers, and create new ePA requests, and who to contact for technical support. We will also cover how pharmacies can initiate a request. We will begin with prior authorization and NYRx, the Medicaid Pharmacy Program. First, we'll provide some background on NYRx, the Medicaid Pharmacy Program. NYRx, the Medicaid Pharmacy Program, covers medically necessary, FDA-approved drugs for New York State Medicaid members. Some drugs require a PA before it will be covered, described in detail in the NYRx Preferred Drug List. Preferred drugs generally do not require a prior authorization when prescribed according to FDA labeling unless otherwise indicated. The NYRx Preferred Drug Quick List provides more information. For a complete list of covered drugs, refer to the Medicaid Pharmacy List of reimbursable drugs. Next, we will review the 3 ways the NYRx, the Medicaid Pharmacy Program, accepts prior authorization requests. There are 3 ways to submit prior authorizations: electronically using CoverMyMeds, by fax, or by phone. This slide provides contact numbers and guidance. We are here today to discuss the electronic method of submission in depth. Next, electronic prior authorizations CoverMyMeds to NYRx, the Medicaid Pharmacy Program. Starting July 15, 2025, NYRx, the Medicaid Pharmacy Program, will launch CoverMyMeds, which provides faster processing and allows prescribers to track approvals in real time. This will provide a more convenient and effective way to handle prior authorizations from start to finish. Links to additional sources of information are provided on this slide. So, what is CoverMyMeds? It's a healthcare technology platform that automates the prior authorization approval process for medications. It works with a network of more than 950,000 providers, 50,000 pharmacies, and payers representing 96% of prescription volume. NYRx will adopt CoverMyMeds as a submission method that prescribers can use to electronically submit prior authorizations to NYRx. Many of you who have submitted a PA to us within the last 6 months are most likely already registered with CoverMyMeds. CoverMyMeds streamlines the ePA approval process, offering numerous benefits. For members, it reduces potential delays for medications, improving access for necessary treatments, and also reduces medication non-adherence, improving outcomes. For pharmacies, it allows initiation of an ePA immediately when a claim is rejected, and provides status to the pharmacy when the ePA is initiated by them. And for prescribers, the benefits are numerous, including the ability to request ePAs, review preferred alternatives, respond to questions, and upload documentation, minimizing additional outreach. It allows for the creation of a new ePA or renewal of an ePA. It's efficient. Prescribers can get real-time status, results, and approvals, and CoverMyMeds is integrated with 350 plus electronic health record or electronic medical record systems. The illustration here shows the NYRx ePA experience. A pharmacy can initiate a new request based on a rejected claim, which is then sent to the prescriber or their authorized agent to process on behalf of the pharmacy. A prescriber or their authorized agent can initiate a new request and submit for approval in addition to processing pharmacy-initiated requests. Once a request is submitted by a prescriber or their authorized agent, it routes to the Prime Pharmacy Benefit Administrator for approval, at which point it travels back to CoverMyMeds and provides determinations. To get started, you will need to create a CoverMyMeds account. If you already have a CoverMyMeds account, great. If you don't, we'll walk you through how to create one. First, go to the website at www.covermymeds.com. On the home page, click Create an Account. Once you click Create an Account, complete the steps as prompted. First, enter your name, email, job title, credentials, and role. Step 2, indicate your familiarity with the medication prior authorization process and if you have previously had a CoverMyMeds account. For the remaining steps, enter your workplace information, indicate your office setting and the type of electronic health record or electronic medical record system you use, and create a username and password. Lastly, click Create Account. Based on the type of account you have, you can perform several actions. If you're a prescriber or a prescriber's authorized agent, you can link your NPI or multiple NPIs to your account, create new ePA requests, process and submit pharmacy-initiated ePA requests, check an ePA request status, or renew ePA requests. If you're a pharmacy, you can verify prescribers, initiate a new request based on a rejected claim, and check ePA request status of pharmacy-initiated ePA requests. Please note that information may also be accessed via CoverMyMeds integrated electronic health record or electronic medical record systems. Next, we'll talk about the CoverMyMeds dashboard. Upon logging in, the dashboard is where prescribers, authorized agents, or pharmacies will perform all tasks. In the left pane, you can create a new ePA request, use the assigned 6 to 8 character alphanumeric key associated to access a specific ePA request, and verify prescribers by linking one or more NPIs to your account. Across the top pane, you can view current ePA requests that have not yet been submitted, and sent to plan ePA requests that have been submitted. Additionally, you can use the search to find ePA requests based on selected criteria. We will take a deeper dive into several of these functions later in the presentation. Next, we will discuss prescriber verification. Before you can begin working with ePA, you will need to verify prescribers. With prescriber verification, ePA requests submitted with a Prescriber National Provider Identifier, or NPI, that has been verified to your account will appear on your dashboard. Whether you are a prescriber linking your NPI or an authorized agent linking multiple NPIs to your account, all users need to take action for the account linking to be successful. To get started, click Verify Prescribers. On the Prescriber Verifications page, click Add Prescribers. Find and select the prescriber you would like to verify and click Next. Select the preferred contact method you want to send the verification code to and then click Send Code. A verification code sent confirmation message appears. Once the verification code is provided by the prescriber, enter the code and click Verify. Prior authorization requests for verified prescribers will automatically be shared with your account and will appear on your dashboard. Next, we'll talk about how a prescriber or their authorized agent can create and submit a new ePA request. This slide illustrates how to request a new electronic prior authorization. From the dashboard, click New Request. And please note that if your electronic health record or electronic medical record system such as Epic, Cerner, or Allscripts is integrated with CoverMyMeds, visiting the portal may not be necessary. Once the new request form appears, you will complete the sections beginning with medication. Enter the medication name or national drug code, at least 3 characters, and then choose the appropriate match from the list. Next, enter the patient's primary diagnosis. Type the diagnosis code into the search field and then from the results, choose the matching diagnosis. Click Continue. Please note that prior authorization should not be submitted for drugs if the diagnosis is excluded by federal and/or state legislation. For more information, see the NYRx excluded diagnoses. Next, enter the patient's insurance. Select option 2, insurance plan or PBM name. Choose New York from the patient insurance state list, and then enter NYRx, the Medicaid Pharmacy Program, as the plan or PBM name if it does not already appear in the field. The next section that appears depends on whether prior authorization is required or not. If a prior authorization is required, select NYRx Medicaid Pharmacy Program Prescription Prior Authorization Request Form and click Start Request. If you've already entered the patient's information, this section will appear populated. If not, enter the patient's demographic information. Note the Add this patient to address book checkbox. If selected, you can add the patient to your patient address book. Once added, access your address book from the dashboard by clicking Patient and then Manage Patients in Address Book, or Account and then Address Book. Once the patient's information is entered, you will need to verify the patient's eligibility. Click Check Eligibility. Note that if Check Eligibility appears grayed out, it means that all required fields have not yet been completed. If eligible, click Select. If there is insufficient or missing information, an error message appears. Confirm the patient's information is correct, and then check eligibility again. I will now turn it over to Brianna Rios.
Thank you, Noah. We will continue with the prescriber information. If you've already entered the prescriber's information, this section will appear populated. If not, enter the prescriber's information. Just like when we added a patient to our address book, you can select the checkbox to add a prescriber. Once added, you can access the address book from the dashboard by clicking Prescriber and then Manage Prescribers in Address Book, or Account and then Address Book. On the drug and diagnosis form, you'll need to provide complete and accurate information for the following. Only select DAW1 if the intention is for the patient to receive a specific NDC or brand product only. Otherwise, click No. In compliance with NYRx, the Medicaid Pharmacy Program's brand less than generic program, PAs should only be requested for a generic version if there is a contraindication to use the brand name product. Please note, required fields are notated with an asterisk. Please complete these fields before proceeding to the next step. For the next step, click Send to Plan. A response will indicate if prior authorization is required or not. If a PA is not required, no further action is needed. If a PA is required, you will be prompted to answer clinical questions. Answer each question. Please note, required fields are notated with an asterisk. When finished, click Send Criteria Responses to Plan. When the authorization decision is returned, if the PA is approved, you will be notified that the request has been approved. If the PA requires additional review, a determination will be provided to the prescriber via fax, and it will also be viewable on the CoverMyMeds dashboard. The response includes a 6 to 8 character alphanumeric key that uniquely identifies a specific PA request. With this key, you can quickly find a previously submitted ePA. Additionally, if calling support, you will need to provide the key information. Now we will transition into pharmacy-initiated ePA requests. There are more than 50,000 pharmacies in the CoverMyMeds program. Any of these pharmacies can initiate a PA when a claim is rejected. To initiate an ePA on behalf of a prescriber with a rejected claim, locate the rejected claim, note the patient's demographic information, the prescriber's information, and the drug information will automatically populate. Verify the information is accurate and correct, and click Send to Prescriber. Please note, if your electronic health record or electronic medical record system is integrated with CoverMyMeds, you may not need to follow this process. Next, we will talk about checking the status of an ePA request. There are several ways to check the status of an ePA request. If you want to check the status of a specific request, you can use the Enter Key function highlighted in the left panel by entering the 6 to 8 character alphanumeric code assigned to that request. If you do not have the request key, you can use the Current tab, highlighted first on the top panel, to check the status of ePA requests not yet submitted, the Sent to Plan tab, highlighted second on the top panel, to check status of ePA requests that have been submitted, or the Search tab, which is highlighted last across the top panel. A list of results based on your selection will display. To further narrow current, Sent to Plan, and search results, you can use the Filter function highlighted under the top panel to limit results created within the last 7, 14, 30, or 90 days. Using the Enter Key function, you can find a specific request by providing the request key, the patient's last name, and the patient's date of birth. This method is useful for renewing a case that is over 90 days old because they can be more difficult to find. Once you've entered the information, click View Request. Using the search function, you can check the status of one or more ePA requests. The search function is automatically set to locate all requests by patient name. To use this option, simply enter the patient's first and last name and then click Search. You can also search by request key, medication, or MPI using the Filter By option. When filtering by these options, the request type automatically defaults to all. To use these options, enter the requested information and then click Search. To further narrow search results, you can use the Filter function to limit results created within the last 7, 14, 30, or 90 days. A list of results based on your selection appears. Once you have located the ePA request, the status is prominently displayed. To view further details, click Open to view the request. Next, we will talk about renewing an ePA request. From the dashboard, you can locate a previously created ePA by using the Enter Key or Search function. To use the Enter Key function, you'll need the patient key that was provided upon submitting an ePA. If you do not have this information, use the Search function. The next slides will describe the steps to access a previously created ePA. In this example, we selected Enter Key as the search option. The Access Your Request screen appears. Enter the patient's information and then click View Request. Confirm the previously created ePA that you want to renew. Click the More icon, which looks like 3 dots, and then click Renew. Next, reconfirm the information. Click Renew to start the new request. Now, review to confirm each section and correct the information if needed. Select the checkbox to the right of each section to confirm the information is correct, and then click Send to Plan. Please note, if Send to Plan appears grayed out, it means that all required fields have not been completed. If you run into any technical issues, you can contact CoverMyMeds support. For issues with logging in, accessing, submitting, or user interface, contact CoverMyMeds support by phone at 1-866-452-5017 from 8 a.m. to 8 p.m. Eastern Time, Monday through Friday excluding holidays, or by chat at www.covermymeds.health/contact-us. While you'll contact CoverMyMeds support for issues with the application, the NYRx Education and Outreach team is available to assist with NYRx coverage questions. Next up, we'll introduce the NYRx E&O team and how to contact us. The purpose and mission of NYRx E&O is to be a liaison between all stakeholders and NYRx to support care coordination. This team assists New York State Department of Health and its stakeholders in several ways: ensuring members receive their medication in a timely manner, facilitating intervention and access for medically complex cases, and providing detailed information about NYRx drug coverage, prior approval requirements, and NYRx enrolled pharmacies. The E&O team is comprised of clinical liaisons who are trained to support complex pharmacy cases, specifically for members who have HIV/AIDS, hemophilia, are in foster care, have serious mental illness, substance use disorder, or hepatitis C. The E&O team serves as a resource for NYRx program-related questions and supports New York State by offering educational opportunities such as this webinar. The E&O team hosts drop-in office hours every Tuesday and Thursday. These sessions are available to all stakeholders. We welcome you to hop in, ask a question, and get support when it's convenient. Office hours are also available by appointment. If a provider or a group of stakeholders needs support, this is especially convenient if it requires PHI discussion. For office hour inquiries, please send an email to nyrxeo@primetherapeutics.com. Please visit our website for more information about the resources and tools that E&O offers. The NYRx Education and Outreach Call Center is available to assist by phone or email. For support, call 1-833-967-7310, Monday to Friday excluding holidays from 8 a.m. to 5 p.m. Eastern Time, or by email at nyrxeo@primetherapeutics.com. Please note, if calling to discuss protected health information known as PHI in the E&O call center, callers must have a MPI or an individual verification number known as IVN, which requires a provisioning process to keep member information protected. Next, we'll discuss resources that are available to you. There are many resources available to provide answers and support. For NYRx E&O, there is the website, the preferred drug list, the PA submission guide, and the how-to guide for submitting a PA to NYRx. For CoverMyMeds, there is the website and the quick guide, which is a how-to guide for electronic prior authorizations via CoverMyMeds. All resources are available on both the NYRx Education and Outreach website and the CoverMyMeds website. This concludes the NYRx Education and Outreach CoverMyMeds Electronic Prior Authorization for New York State Medicaid Prescribers webinar. We hope that the information provided was helpful. Thank you for joining us today.